They're all pieces of the puzzle for innovative solutions to a community problem. From the detectives trying to make the busts.
My squad specifically goes after the people who are selling this poison on the street.
To the laws targeting the dealers who get users high.
If you stop the supply, you stop the problem.
To the researchers on the front lines advocating for a positive outlet.
Also, how do we cope with stress in a healthy and productive way?
10 Investigates Overdosed.
Thanks for joining us. The 10 Investigates team is giving you a look at the effects of addiction and overdose.
We're taking a deeper dive into the problem and the possible solutions. Chances are someone you know is taking fentanyl. The spike in overdose deaths from synthetic opioids, mostly fentanyl, increased more than 56% from 2019 to 2020, surpassing heroin and methadone. Adults ages 35 to 44 are one of the groups most likely to use. They saw the highest increase at more than 30%, and it's men who are most likely to overdose.
So who's tackling the problem? 10 Tampa Bay's Liz Crawford talked to Hillsborough County's Overdose Squad. Their special investigators say drugs are killing people at a rate they've never seen before.
Well, you might already know that we have an overdose crisis in Florida, but I wanted to know the specifics. What exactly is the problem, and why is it worse now than it's ever been?
Sir!
Everyone has their own story.
Capital 9 Baker 1, can you start medical?
No one wakes up and says, you know what, I'm going to use heroin, I'm going to use fentanyl today.
For some, it's rooted in mental illness. Others say it started with recreational use as a teen. For many, it was legitimate pain, leading to prescription painkillers.
They'll tell me that it's the best feeling they've ever felt in their life. It makes them euphoric. It completely takes their pain away, it takes their depression away, it takes all these things away.
Before you know it, you're chasing euphoria, and the goalposts keep changing.
Once you start building a tolerance to any of these types of things, now that feeling that you once had is not as strong as it was before. So the only way that you can get that experience again is to take more.
Until you take too much, and you find yourself here.
What did she take?
Overdosed and on the verge of death.
The blues, the fentanyl. Hey.
Think it's a wake-up call? Not usually.
Hope I did the right thing.
Why are you buying, this stuff that's making you overdose? And they say, well, that's the best stuff on the street.
Hey.
Overdoses also happen because people didn't know the drug they bought was laced with something else, something stronger and more potent.
You may think that you're taking one thing, and then it could be a deadly poison of something else.
Like you think it's an Adderall, and it's something else.
Could be fentanyl.
Come on, boss!
That's partly why law enforcement is going after the dealers.
A lot of these dealers, they don't even use the stuff. It's just a business for them. And the more potent stuff that they have, then the more customers that they get.
Their work is undercover and time-consuming.
This crisis, it may be huge, but it's worth the fight.
There you go. You just relax. I had to do two.
According to Live Tampa Bay, the overdose rate in our area is 10% higher than the state and 50% higher than the nation. Nearly 3 people die every day in the Tampa Bay area from an overdose. The DEA is warning there has been a spike in mass overdoses over spring break. 2 months ago in South Florida, 6 people overdosed on cocaine that turned out to contain fentanyl too. Fort Lauderdale Fire Rescue says they were West Point cadets on vacation. 4 people went into cardiac arrest and 2 others were exposed when they tried to give CPR. Throughout the newscast, we want to offer you resources for getting the help that you or someone you know might need. We've put them together for you on our website. Just text this number, 727-577-8522, with the word overdose, and we'll send you a link directly to your phone.
While fatal drug overdoses continue to rise, there's a law in the state of Florida that allows prosecutors to charge those who dealt the drugs with murder. But as I uncovered, the numbers of those charged are quite low compared to the increase in deaths.
This is Katie's room. We have all her trophies, all her cheerleading hair bows.
Dawn Golden Golden says it's these memories that help her get through.
This is her urn with her ashes.
The fact that Katie is no longer here.
You miss her every day.
Oh, yeah.
Katie Golden passed away from a drug overdose.
That was 5 years ago, April 1st. It was her senior prom, and that was the last photo we took.
The man police officers say sold the drugs that killed Katie? This man, Garland Layton. He is facing a first-degree murder charge for distributing heroin that caused death.
When I look at the crisis that this country is facing, I'm glad that we have this specific tool in our toolkit.
That tool is Florida's death by distribution law. Put in place during the war on drugs in the 80s, people who deal certain drugs that cause death can be charged for their murder. In 2017, Governor Scott signed into law for fentanyl to be added to the law.
So we're aggressively prosecuting the dealers and the suppliers who sell this poison into our community.
But even so, as the opioid crisis wreaks havoc on the state, many states' attorneys across the state have only used this charge a handful of times since 2017. Hillsborough County State Attorney Andrew Warren has used it 9 times. He says that's the most in the state.
Is that number too low?
Well, again, I mean, the number's low relative to the number of overdose deaths. I think we can all agree there's a difference between 2 friends who are sharing drugs and one of them overdoses versus the Pablo Escobar who is profiting by dumping drugs into our community, in terms of which case should be prosecuted. These cases are really hard for law enforcement to even start an investigation, much less come to a prosecutor to finish that prosecution. There's often no witnesses. People are using drugs and they die often by themselves. There's often no paper trail. There are not receipts and clear records of where the drugs came from.
You stop the supply, you stop the problem. The people are selling poison and it's killing people and they know it, they don't care. If you don't prosecute them, they're just gonna keep handing out poison to our kids.
Dawn Golden says she hopes more people are charged with this law. And justice will be served for those dealing deadly drugs.
We've lost Katie, there's nothing else that can hurt us any worse. So getting her justice is, is what we can do to make a difference, to make her life matter.
Fentanyl has been around since the 1960s as a pharmaceutical drug, but street use started to increase nearly a decade ago, especially in the Northeast. Then it spread to other parts of the country, including Florida. In 2016, Prince died of an accidental overdose at his home in Minnesota. The 57-year-old started taking the painkillers to cope with some torn injuries before he became addicted. While some are prescribed the powerful drug, others are finding it rather easy to come by on the street. So how is it circulating? DEA Special Agent Mike Ferguson shared this sharper insight that is predominantly shipped to the Bay Area in packages originating from Mexico.
There's pure anonymity behind sending it through the mail. The recipient may be a fake name, and as well as the sender may be a fake name. The chemicals are derived from China, shipped into Mexico, where the laboratories are then producing what we see as straight fentanyl powder, and or a lot of what we're starting to see are pressed pills.
He says the drugs, which look like popular prescriptions, are easily distributed between here and Orlando.
From heroin to fentanyl, opioids have been separating families across the Tampa Bay area for years. There are 22,000 kids in the foster system here in Florida, and substance abuse is the #1 reason why kids are removed from their homes and put in foster care, according to the National Youth Advocacy Program. That organization works with the Safe Children Coalition in Sarasota to provide foster homes to kids whose parents are in crisis.
We have the trauma from them being in a home environment that's not safe, whether it be abuse or neglect, and they have trauma from that. Then we deal with removing that child from their parents, from their family. There's trauma that comes with that. And then we face the trauma of kids coming into care, possibly being separated from their siblings, being put in a shelter for a week, then going to another placement for a foster home for another week, and moving around the area. I mean, it's just intensifies that trauma that they're already dealing with.
Hernandez says exploring whether you would make a good fit to open your home to a child in need starts with a conversation with other foster parents or advocates about what it's like to foster kids.
When it comes to drug use, addiction does not discriminate, but the factors leading to it can. And new research shows deadly drug overdoses are rising fastest among Black Americans, and the pandemic made it worse. To find out the impact in our own community, we followed 2 leaders in our area on the front lines of fighting fentanyl.
The leading scientists in the world on this issue have tied a direct line from systemic racism to fentanyl in the Black community.
God, our communities have been destroyed and harmed by dangerous drugs.
Outside St. Pete's Woodson African American Museum.
Opioid and fentanyl have worked their ways into our communities.
An unlikely scene.
Lift up the head and the spirit of those who are fighting addiction.
Prayers to fight fentanyl.
I think it's very easy, to be honest with you, to focus on communion, weddings, funerals, Sunday school, and not deal with the tragedy of homes being broken because of drugs.
The Reverend J.C. Pritchett works with community groups on solutions. He says drugs have been a taboo topic in the church for way too long, and it's going to take more than prayers to solve this crisis.
We can't pretend that it doesn't exist because it does.
And it's impacting Black Floridians in numbers growing faster than any other group. According to Live Tampa Bay, the opioid overdose death rate for Black Floridians increased 330% from 2014 to 2018.
How this crisis affects our community is different than another community. And so several things happened with the global pandemic. We weren't gathering on a regular basis as we do in our tradition at worship on Sundays. That's a support system several times a week that literally was removed from our community. When you are hurt, you're looking for an answer, you're looking for a salve, a solution to feel better. And again, a Black answer for a Black problem, that since 1619, the Black body has been attacked, it's been discriminated against, it's had to deal with different aspects of being a person of color in this country.
I started out first drinking and then marijuana, and then by 11 I was sniffing heroin.
Fentanyl isn't the first opioid crisis to hit the Black community.
My intention was more or less for a false sense of enjoyment, a false sense of fulfillment, to kind of like be able to deal with my feelings of worthlessness inside.
USF researcher Dr. Micah Johnson studies drug misuse. He says the heroin epidemic of the 70s and 80s should be a lesson for today.
The face of the opioid crisis at that time was poor Black people. Therefore, it was met with a lot of insensitivity, no resources, no humanization, and locking people up and treating them like animals.
A disparity Johnson hopes to better address this time around.
Well, we're heading down to one of the best facilities in our college. Over 2,000 square feet research laboratory, the largest cluster of African American researchers in the country, probably. Gifted through a $1.5 million grant from NIH.
In this new space,
how do the drugs get into these communities?
USF researchers will study the impact fentanyl and other drug use is having on minority communities.
We don't quite understand the impact it's having because we haven't been able to do the research fast enough to keep up with the epidemic.
Neither has the state. The Florida Department of Health tracks a lot of drug data, but we couldn't find any racial breakdowns for fentanyl.
We've been worried about disparities.
State Senator Darrell Roussan once had his own battle with drugs, and he's behind a new law that requires each county to create health equity plans.
The first thing we need to do is track the data.
He says tracking fentanyl in Black communities should be a priority.
Nothing is more urgent than losing lives to fentanyl and to other types of drug overdoses.
Throughout the history of time, drugs have been considered medicines, right? So why are people overindulging in certain substances and certain medicines? One paradigm is it's to cope.
Dr. Johnson says fentanyl is especially harmful in low-income Black communities that formed as the result of racial segregation. He says the street supply is getting more dangerous.
The fentanyl is so powerful that it's used to cut and mix with other drugs to maintain a certain potency.
Johnson says the drugs are some people's way of dealing with life's pressures, when they don't have the tools or resources to cope.
Folks who are hopeless are 4 to 8 times more likely to misuse opioids. I've heard folks mention the widespread availability of drugs, but the lack of healthcare services, not just therapy, but any sort of healthcare services in their communities, and that's a huge problem. Systemic racism is a critical issue, a critical barrier by which people feel stress, and also that blocks people from access.
So to find a solution,
we have to address the social stressors that are causing people to need to cope. That thing called hope.
You, the creator of everything,
is so important.
offer hope.
For those who feel hopeless, they turn to these drugs to escape that hopelessness.
the people you saw in this piece, they're working to make sure that people can have that hope. And that research center at USF, Dr. Johnson says it is one of, if not the largest in the nation, studying addiction when it comes to drug use in communities of color.
We're going to be back tomorrow at 6, focusing on the innovative and even controversial solutions to helping people stay alive long enough to get into recovery. In the meantime, groups like the Crisis Center of Tampa Bay and Families Against Fentanyl can put you in touch with someone who can help.
That includes the Substance Abuse and Mental Health Services Administration 24/7 hotline. It's free and confidential.
We've put all of these together for you on our website. Just text this number, 727-577-8522 with the word overdose, and we'll send you a link directly to your phone.
Okay, we've shown you the problem. Now it's time to look at innovative solutions, ways to help people with addiction stay alive long enough to get into recovery. Here's part 2 of our special series, Overdosed.
They're all pieces of the puzzle for innovative solutions to a community problem. From the families looking for ways to spot deadly opioids,
had he not taken drugs with fentanyl in it, he might have had a chance.
to those in recovery looking for a positive outlet.
Lose my wife, I'm gonna lose my kids, I'm gonna lose my job, I'm gonna be homeless.
To foster care advocates trying to pick up the pieces of broken families.
What happened to these kids is the saddest thing, and now we're wrapping them in love and support.
10 investigates Overdosed.
Thank you for joining us for part 2 of our special. Part 1 showed you how this problem is gripping our community.
Now we'll focus on solutions, and some are a little unorthodox. CDC data shows that every 7.5 minutes, someone in the U.S. dies from a synthetic opioid overdose. That means by the time this special is over, we will lose 3 more people.
And overdose rates continue to soar. There are more young adults dying from fentanyl than from suicide, COVID-19, and car crashes. And that's according to Families Against Fentanyl, a group that wants to raise awareness about just how bad this synthetic opioid can be. Seeing fentanyl take over as the top drug in Florida for overdoses at 73%. One of those prevention efforts, Jen, is a simple strip.
Yep, just a simple strip. Looks like this. This is a fentanyl drug testing strip, but these we've uncovered are illegal in the state of Florida.
Always talked a lot since he was a little baby, and he never stopped.
The best cat in the world, Charlie. Ow.
Nick was always somebody that he marched to the tune of a different drummer. He was always a little bit different, very, very funny.
Ryan was so funny. He had like a sixth sense for nature and animals.
He's just got the biggest smile on his face. And then I love this one. This shows his love for nature. It's him with his little boa constrictor snake.
If anything, I feel like it gets harder right now because the shock is starting to wear off a little, and it's starting to set in that this is my new reality, that he's not here.
You can't describe what it's like to lose a child.
Both men battled addiction over the years. When Ryan passed, he had just popped a counterfeit pill.
He did not take those pills intending to die, and he just didn't know that there was fentanyl in it.
Nick had just purchased heroin.
And he wasn't breathing and he wasn't responding, so I got Mike and I called 911, and they couldn't bring him back. A few months later, I found out that the heroin had been laced with fentanyl, and I asked Nick's girlfriend, who was with him when he bought it, if he knew that it had fentanyl in it. She said no.
According to the latest state data, deaths involving fentanyl increased by 63% from 2019 to 2020, and it's only getting worse.
Latest meeting I was at with the medical examiner for Hillsborough County, we're going to exceed overdose deaths again this year from the year before, and fentanyl is the #1 drug found on board.
Like you heard from Ryan and Nick's families, they believe their loved ones didn't know that the drugs they were using were laced with fentanyl. Now take a look at this. This right here is a fentanyl test strip. Costs about $1 a piece on Amazon, and the strip will tell a user whether or not their drugs are laced with fentanyl. Thing is, I can't order these here in Florida, because if I did, I'd be breaking the law.
It may have been thought at one time that it may be enabling drug use. However, with what we're seeing now, with all of the overdoses for fentanyl, it could save a life.
I'll try to do this without crying. His name is Landon. He was 25.
Arizona Senator Christine Marsh lost her son Landon to an overdose. The drugs laced with fentanyl.
Of course, I miss him every day.
Arizona was one of 10 states across the country where drug testing strips are illegal.
So were you shocked then when you found out that these drug testing strips were illegal in some states, including Arizona, including Florida, that people were actually labeling them as drug paraphernalia?
Yeah, I mean, beyond, I was absolutely stunned. It is so illogical to me.
It's why she wrote a bill to legalize the fentanyl drug testing strips in Arizona. It passed with bipartisan support.
It is not going to stop the opioid crisis. It's not going to stop fentanyl overdoses, but it does provide one more valuable tool to be used to keep people alive.
Florida also introduced a bill last session to legalize these strips. It never saw any movement, but lawmakers are hopeful that won't be the case this coming year.
It would be a great tool to have for people who are using drugs, but then it would give them that chance to get clean and to turn their life around.
I would have done anything to bring him back, to give him some more time, to hopefully fight and beat the addiction. But he didn't have that chance.
I also found this study conducted in North Carolina in 2019 that looks at the effectiveness of the strips. And the conclusion reads, fentanyl test strips may represent an effective addition to current overdose prevention efforts when included with other evidence-based strategies to prevent opioid overdose and related harm. Taking a deeper dive into just how powerful fentanyl can be, the CDC says it is 50 to 100 times more potent than morphine. The synthetic opioid is prescribed to patients who are in severe pain, like those going through advanced cancer treatments or even hospice care, because it doesn't have to be given in a pill. But the drug can also be made illegally, and it's often mixed with heroin or cocaine for its euphoric effects, sometimes without the user's knowledge. Throughout the newscast, we want to offer you resources for getting the help that you or someone you know might need. We've put them together for you on our website. Just text this number, 727-577-8522, with the word overdose, and we'll send you a link directly to your phone.
What we've been doing to prevent fentanyl overdose deaths clearly is not working. So how do we keep people alive long enough to make it into addiction treatment? In our new episode of What's Brewing on YouTube, we're taking a deeper dive into a controversial strategy to save lives. Tell me about why you wanted to meet at this park.
Well, this is an area where I grew up as a child, and I used to come to this park all the time when I was little, and later when I was in my active addiction, I would come here to seek refuge and use drugs. And now this park has taken on a different meaning because I have now in recovery been able to take my children here, been able to bring other women here to do step work and talk about recovery.
How many times have you overdosed on fentanyl?
I overdosed 6 times that I can remember.
How quickly does a fentanyl overdose hit you?
A fentanyl overdose is instantaneous. Before you even realize that you're overdosing, you are unconscious.
We're taking a deep dive into a strategy that might sound counterproductive to you at first, giving people safe, supervised places to use drugs. Right now you're looking at video of one in Barcelona. Overdose prevention centers are facilities where people go to use drugs under the supervision of trained staff. Those staff members monitor users for signs of overdose and intervene if they start showing symptoms. They've been around in Europe for at least 30 years. Right now, there are more than 120 overdose prevention centers in 10 countries, according to the Drug Policy Alliance. But even within the recovery community, there are mixed feelings about this strategy.
What's not to love about jiu-jitsu?
For years, Brandon Spencer's addiction stole jiu-jitsu from him.
It turns into this phenomenon of craving, which is a craving beyond my physical control. I'll literally be walking to go get some and telling myself, I'm gonna lose everything. I'm gonna lose my wife. I'm gonna lose my kids. I'm gonna lose my job. I'm gonna be homeless. I might die. And I can't stop them feet from moving. I just can't stop them.
Spencer says having access to an overdose prevention center would have enabled him to keep using.
It would have hindered me. It would have gave me another justifiable reason to continue to get loaded. See, the doctors are watching me. It's okay.
A lot of research has been done on overdose prevention centers, but the American Medical Association kind of summed it all up in 2017 when it said, studies from other countries have shown that supervised injection facilities reduce the number of overdose deaths, reduce transmission rates of infectious disease, and increase the number of individuals initiating treatment for substance use disorders without increasing drug trafficking or crime in the areas where the facilities are located. After decades of success in other countries, the U.S. just got our first 2 officially sanctioned overdose prevention centers on November 30th, 2021, both in New York City. Since they opened less than 6 months ago, staff have intervened in more than 260 overdoses.
I know for some they might be hearing this and thinking that this is a little bit outside the box, a little bit not what I'm used to, but we're really kind of in a desperate situation.
Rhode Island lawmakers decided last year to authorize a 2-year pilot program to establish what they're calling harm reduction centers. The state started accepting applications in February 2022 for licenses to run those centers. Philadelphia, California, Denver, and Seattle have all explored opening overdose prevention centers, but none have actually materialized. So why is the U.S. decades behind other countries on this strategy? USF Associate Professor Dr. Carrie Rigg says Americans still have an old-school perception of people who use drugs.
Addiction was a moral failing, it was a criminal justice problem, but now we have a lot more science around addiction, and we know that it is in fact a healthcare problem.
I remember being in the DARE program in the late 90s. I'm dating myself a little bit.
I'm with you, I'm right there.
But that was the sentiment that I got, was that, just don't use drugs and say no, and people who use drugs are bad and dangerous. How are we still stuck in that way of thinking in Florida?
Unfortunately, we are.
Is anyone talking about overdose prevention centers here in Florida?
No.
This is Will Atkinson. He's the executive director of the Recovery Epicenter Foundation in Pinellas and Pasco counties. He says overdose prevention centers don't fit Florida's Mickey Mouse beach paradise image.
The more that we've focused on tourism and the more we've presented ourselves as a retirement community, the less we've been interested in addressing substance use disorders, mental health disorders, homelessness, because that might be unattractive to those who would seek to live here.
So what are we doing in Florida to help keep people with addiction alive? Hillsborough is one of 5 counties that has syringe exchanges, places where people can go to drop off used needles, get clean ones, and get connected to healthcare and recovery services. We're giving you an inside look and so much more in our full episode of What's Brewing on YouTube. Take out your phone or tablet because this code is going to make it really easy for you to find. Open your camera app and point it at this code. No need to take a picture. A link is going to pop right up to take you directly to our YouTube channel, The Deeper Dive. And Emerald, while overdose prevention centers have been controversial, something that's getting less resistance is expanding access to Narcan.
That's absolutely right, Jenna. This new state law takes effect July 1st, and schools will be able to stock Narcan on campus just like they do with EpiPens. Senator Jason Pizzo is behind the push, and this would clear school district employees from liability if they tried to save someone during an overdose. The idea came from a meeting with students a few years back. This session, it passed through both the House and the Senate, and he says there is a misconception that kids are not at risk.
This only applies to adults, as if like this never happens to 16 and 17-year-olds. And I can tell you as a father of twin 15-year-old identical twin boys, they spend more time at school than they do with me on any given day. So, things are going to happen, whether they're intentional or accidental, but certainly we can prevent tragedies by making this available.
Law enforcement, including probation officers and child protective investigators, will not be held liable for trying to help someone during an overdose while on the job. The website I Save Florida will link you to resources in your area that provide naloxone and potentially save a life.
With so many people in need of help, either for themselves or for someone else, having the right resources is critical.
The Crisis Center of Tampa Bay is just one phone call away, offering more than 4,000 resources.
You can see they have people ready to take calls, and they will help connect you with substance treatment, even if you don't have the means to pay. They also want to make sure that those who are trying to take care of a loved one with an addiction get the mental help they need too. The veteran care coordinator says often those calls are the most difficult to answer.
They don't know what to do. They're in tears, and they have maybe even looked for some facilities and found out that they were $800 or $1,000 a day, so they didn't know where to turn, so they give us a call.
He says often the callers are homeless. Intervention specialists can help find resources to help find a place to stay as well. The Crisis Center answers calls 24/7, and you can call 211 here in our area or 1-800-662-HELP throughout the state of Florida.
The Crisis Center is just one of the many resources we've put together for you on our website. Just text this number, 727-577-8522, with the word overdose, and we'll send you a link directly to your phone.
Thanks for watching Overdosed.
If you have something you want us to check out, send us an email at tips@10tampabay.com.
You can see more of our investigations at 10tampabay.com/10investigates.